Ever wondered how your face moves when you smile or frown? Let's explore the muscles behind every expression. Facial muscles are a unique group responsible for expressions, speech, blinking, chewing, and breathing. There are around 30 of these muscles, though the exact number can vary. Unlike most muscles, facial muscles are located within the subcutaneous tissue and insert into the skin rather than bones. This allows for precise and delicate movements that shape our expressions. All facial muscles originate from the second pharyngeal arch during embryonic development, giving them a shared anatomical and functional heritage. Facial muscles are divided into 5 main groups based on their location, each playing a key role in movement and expression. Epicranial muscles control scalp and forehead movement, including eyebrow raising. Circumorbital and palpebral muscles surround the eyes and eyelids, allowing blinking and squinting. The nasal muscles regulate nostril movement, assisting in breathing and expressions like flaring or compression. Buccolabial muscles surround the mouth and cheeks, enabling smiling, frowning, speaking, and lip movement. The auricular muscles are a group of small muscles around the ear, with limited function in most people. These muscles work together to create facial expressions, control movements, and assist in speaking and breathing. They allow us to convey emotions, communicate, and perform essential daily functions effortlessly. The muscles of facial expression are all innervated by the facial nerve, or seventh cranial nerve. You can see its main branches supplying each of these muscle groups. Facial nerve palsy disrupts the function of the facial muscles, leading to weakness or paralysis on one side of the face. This can cause difficulty in closing the eye, smiling, speaking, and controlling facial expressions, often resulting in an obvious facial asymmetry. Occipitofrontalis. This broad muscle has 2 parts: the frontal belly, which arises from the epicranial aponeurosis and inserts into the skin of the forehead, and the occipital belly, which originates from the occipital bone. It helps raise the eyebrows, wrinkle the forehead, and move the scalp back and forth, playing a key role in expressions of surprise or curiosity. Orbicularis oculi. This circular muscle surrounds the eye, originating from the medial orbital margin and inserting into the skin around the eyelids. It tightly closes the eye when blinking, squinting, or protecting the eye from bright light or dust. Corrugator supercilii, positioned deep to the frontalis. This small, narrow muscle runs from the superciliary arch, above the eye socket, to the skin of the forehead. It pulls the eyebrows downward and together, creating vertical wrinkles between the eyebrows, giving a frowning or concerned expression. Compressor narium minor, a small muscle that arises from the maxilla, or upper jaw, and inserts into the nasal cartilage, squeezing the nostrils slightly to control airflow. Dilator naris anterior, a thin muscle extending from the maxilla to the nasal cartilage, responsible for widening the nostrils during deep breaths, such as when exercising or gasping. Levator labii superioris aliquae nasi, a long, narrow muscle that originates from the maxilla and runs down to the upper lip and nostril. It both lifts the upper lip and flares the nostrils, creating a look of disgust or deep inhalation. Depressor septi nasi. This small muscle runs from the maxilla to the nasal septum, pulling the nasal tip downward and assisting in closing the nostrils slightly when exhaling forcefully. Nasalis, a paired muscle with two parts. The transverse part compresses the nostrils, while the alar part flares them. It's crucial for changing nasal airflow during different breathing patterns. Procerus, a small, thin muscle stretching from the nasal bone to the lower forehead skin. It pulls the inner eyebrows downward, creating horizontal wrinkles over the bridge of the nose, commonly seen when expressing anger or deep concentration. Buccinator, a deep, flat muscle that originates from the maxilla and mandible and inserts into the orbicularis oris. It presses the cheeks against the teeth, helping with chewing, blowing air like playing a trumpet, and whistling. Depressor anguli oris. This triangular muscle extends from the mandible to the corners of the mouth. It pulls the mouth downward, forming a frown and conveying sadness or displeasure. Depressor labii inferioris. Running from the mandible to the lower lip, this muscle pulls the lower lip downward and slightly forward, as in pouting or showing doubt. Levator anguli oris. Originating from the maxilla and inserting at the mouth's corner, this muscle lifts the corners of the mouth, contributing to a subtle smile. Levator labii superioris. This muscle runs from the maxilla to the upper lip, raising it to expose the upper teeth, often seen in an expression of surprise or mild aggression. Mentalis. Located at the chin, it extends from the mandible to the skin of the lower lip. It pushes the lower lip upward and forward, creating chin dimples, often associated with expressions of doubt and indecision. Orbicularis oris, a circular muscle surrounding the mouth, inserting into the lips. It controls lip movements, allowing actions like pursing, kissing, and speaking. Risorius, a thin, superficial muscle that stretches from the fascia of the masseter to the corners of the mouth. It pulls the mouth laterally, producing a strained, forced smile or grin. Zygomaticus minor. Originating from the zygomatic bone and inserting into the upper lip, it lifts the lip, slightly assisting smile and contributing to expressions of smugness or sarcasm. Zygomaticus major. Running from the zygomatic bone to the mouth's angle, this is the true smiling muscle, raising the corners of the mouth upward and outward in genuine happiness. Auricular muscles help move the pinna, or outer ear, in different directions, though their function is minimal in humans. They are more developed in animals, allowing better sound localization. Auricularis anterior, a small muscle extending from the temporal fascia to the front of the ear, pulling the ear slightly forward. Auricularis superior, positioned above the ear, it runs from the epicranial aponeurosis to the auricle, lifting the ear slightly in people who can control it. Auricularis posterior, running from the mastoid process to the back of the ear, it pulls the ear slightly backward but has little function in most people. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more anatomy insights. See you in the next video.